those are all non-starters. We're not going to go down a path that separates people from healthcare.
That's Addictions Minister Jennifer Whiteside rejecting the recommendation from BC's public health officer that the government explore the use of compassion clubs or even retail stores to distribute hard drugs. Dr. Bonnie Henry's latest report on BC's Safe Supply program envisions a system where people no longer have to go to a pharmacist to access opioids like hydromorphone. Henry says there are too many barriers that prevent people from accessing safer supply drugs, and as a result, they turn to toxic and potentially lethal street drugs.
So we have to take evidence from other types of initiatives, for example, related to cannabis use in the past.
Critics say Henry's proposal would make hard drugs like heroin, cocaine, and methamphetamine as easy to get as cannabis.
One of the scenarios that they're proposing is that illicit drugs, find their way onto shelves, store shelves, be accessible to people through retailers, which I think is not only irresponsible, but frankly, I think it's dangerous.
Earlier this year, Premier David Eby recriminalized the use of hard drugs in public spaces, putting him at odds with Dr. Henry, who has long advocated for drug decriminalization. Henry's report says an example of a non-prescription model is the now shuttered Opioid Compassion Club operated by the Drug User Liberation Front, or DULF. DULF was shut down in October, and its co-founders were arrested and charged with possession for the purpose of trafficking. The province's Safe Supply program has come under fire recently, with Sturco and federal Conservative leader Pierre Poilievre calling prescription opioids government-supplied addictive drugs. University of Victoria researcher Bernie Pauly, who contributed to Henry's report, said urgent action is needed to stop people from using toxic street drugs, which are killing an average of 7 people a day.
People are dying now. And if we don't do something, we will be culpable for that in the future.
Dr. Henry seemed prepared on Thursday that the government would not be receptive to her approach to safe supply. She told reporters it's her role to provide the best advice on health issues, regardless of who is in political power. Katie DeRosa, CBC News, Victoria.